life, wisdom.
Psyche Truth Massage.
Hi everybody, this is Gregory Gorey with BodyWorkMasters.com, and today we're going to be doing some neck work, and specifically we're going to be employing some muscle energy techniques to find out or to work with any fixations that we find or subluxations that we find. So I'm just going to come down, starting with the neck, and I'm looking for a bony, hard spot that's kind of sticking out at me. So as I'm coming down, there's one right there, and you probably saw her face react. So what that is two vertebrae that are sitting on top of each other, and when you feel that bony thing pop out at you, that is one side closing and then rotating towards you. So we are going to gently try to stretch that back into place. You can go to a chiropractor and he can give you a manipulation to put that back into place, or we can do soft tissue work to gently stretch that back into place without having to do any snapping and popping. So it's coming and close and then rotating towards you. So what we're going to do is we're going to open the joint, derotate it, and then either bring it into flexion or extension. And the reason that we're doing that is I'm going to find that bony spot. So what I'd like you to do is to bring your chin down and then bring your chin all the way up and tell me which hurts more.
Down.
Down. So that means if it hurts more when it comes down rather than up, that means that the vertebra is stuck closed. So it's having a hard time opening. If it had been more tender when she brought her head up, that would mean that the other side is stuck open and won't close. So we are going to find that spot again, and then what I need from you is a dead head. Let me do all of the motion, and I am going to gently side bend until I start to feel that vertebra move underneath my finger, and then back off just a tiniest bit once I feel it move, so that the biomechanical forces are brought to bear there. And then I'm going to de-rotate, so I'm moving very slowly until I feel that vertebra start to move, and then back off from there. And then I'm going to bring the chin down until I start to feel that to move. Now from there, I want you to come back to the starting position using very little effort. You're going to use about 10% of your muscular force to come back to the center. That is perfect, but I want you to hold it for a little longer. And relax. We've now stimulated the muscle spindles that are locking that into place. I'm going to side bend again. I'm going to de-rotate, and then I'm going to bring it down a little bit further. Come back to the starting position again. Perfect. And relax. And now coming side bending again. Let me do all the motion for you. Side bend, de-rotating, and coming down, and come back to the starting position again. And relax. And let's do that again. One more side bend, rotate, and bring it down, and contract again, trying to get back to the neutral position, using only about 10% of your musculature, because you're not trying to, if you get somebody on your table and you can relax, side bend, rotate, and down. If the person on the table is contracting too much, what will happen is you'll stimulate the big extrinsic muscles that are the main movers. And what we want to do is to find the little tiny intrinsic muscles and get those stimulated and then stretch them back into place. So let me come back down. And does that feel better? Mm-hmm. It feels like it's more into place. There's some other things that we can do, but that bone isn't jutting out at me anymore. It's back into a more natural position. So that one's back into place. I'm going to come down, see if any of this. And that one is out of place, and then you can see her jump. So with this, is that more intense when you bring your chin down or when you bring your chin up?
Down.
Down. And when you have your client do this, you'll actually usually be able to feel, like when she went up, it didn't feel like it was poking out at me anymore, because she doesn't have a problem with this joint closing. She has a problem with this joint opening. So I'm going to do the exact same thing. You're going to give me a totally dead head. This is going to be a very small movement because this is C2, and you're going to get motion through there almost right away. So slight head bend. Let me do it for you. Don't engage at all. There. De-rotating, bringing the chin down. Okay, 10% of your muscular force, come back to neutral. And relax, side bend, rotate, down. And come back to the starting position. And relax. Rotate, side bend, down. And one more time. And relax, rotate sideways, down. Good. So that definitely got, she would have jumped off the table like she did the first time. I'm pressing harder now. So that's tender for her, but it's not poking out at me, so I'm not going to try to use any of that. But what I am going to do is I'm just going to come and gently do some myofascial work, pull this up and out. A little discomfort with some of these techniques. Well, actually, those two techniques that we just did, the muscle energy techniques, there should be no pain at all. And you need to communicate with your client that if there's any pain, you need to stop because it shouldn't hurt. When I'm doing a general release like this, you can have a little bit of discomfort, but it shouldn't be to the point where she's holding her breath and clenching. If she's doing that, you're working too hard and her nervous system isn't going to let go. So coming in, releasing the upper trapezius. Generally with the upper trapezius, you want to be working this way if you have any therapeutic intention. If you're just trying to get somebody to relax, do whatever you want. It'll feel good. If you're trying to do structural work, you want to come in and you want to pull this tissue towards the midline. And actually, not only towards the midline, you want to be bringing it back, because generally we're in a flexion-dominant society, so everything rolls forward, and we want this to come back. So as I'm doing this, there's actually a downward kind of motion to it, as I'm just encouraging the tissue to be in a more neutral position. You can also do trigger point work with this and just go section by section, holding this, and that's tender spot, So we're going to hang out and just release, going to the next one. And that one's also a little tender. I could see her. She didn't need to tell me, I could see it on her face. And that just let go. Good. So we did the upper trapezius, got these vertebrae more in a position that we want them by releasing the muscles. We're also going to do a little work on her SCM. She has a history of headaches and migraines, and this SCM can be loaded with trigger points that fire into the head, and we're going to find out if that's the case with her. So coming in, just doing a kind of a pincer palpation with the sternocleidomastoid being shortened. And that's a tender spot. That's starting to release. And is it tender just right there, or is it referring sensation into other areas? It's sending it up towards your ear. That's a classic referral pattern. And is that starting to let go? Good. Coming up. You can also slightly elevate the head with the head turned. That'll shorten this muscle further and it'll make it easier for you to grasp it. Is that tender again? And letting go and coming down. Good. Coming to this other side. Let me know if any of these guys are hot, extra hot. And not so much on this side. All right, well, I hope you enjoyed the video, and please don't forget to like and subscribe, and we'll see you next time. Bodyworkmasters.com.